Hello everyone, my name is Sandra and today I'll be sharing my health communication campaign titled Man's Mental Health Matters. Support is Strength. This presentation will walk through the purpose of my campaign, who it was designed for, how I created it and tested it, and what I learned from the process. Here's a brief outline of what I'll cover today. I'll start with an overview of my campaign, talk about why this topic is so important, describe my target audience, and walk through the goals and communication methods I used. I'll also explain my design process, summarize the feedback I received during piloting, evaluate my campaign's effectiveness, and end with key takeaways. On this slide, it is my flyer that I designed for Men's Mental Health Matters, and I put on one side healthy ways to cope, and on the other side I put things that they might be experiencing that can help them identify if they're going through something that needs, an action to be taken. And I made sure that on bottom I put the crisis hotline and the text line for people to be able to use that. Okay, for the justification for my campaign, I chose men's mental health because it's an incredibly important but often overlooked issue. Young adult men experience high levels of stress, but they are also the least likely to seek support. Many feel pressure to stay strong, which can lead to silence instead of reaching out. And this silence can be very dangerous. Men ages 18 to 25 face some of the highest suicide rates, and many tend to use unhealthy coping strategies like withdrawal or substance use. Raising awareness in this age group can help normalize asking for help and open the door to healthier coping and earlier interventions. My target audience. My target audience is college men ages 18 to 25. This group was chosen because they are in the major transition period, with learning independence, dealing with academic pressure, and navigating identity and relationships. Research shows that men in this age group struggle quietly, often feeling embarrassed or unsure how to get help. Because of this, they need messaging that's simple, approachable, and stigma-free. My campaign goals. The long-term goals of my campaign are to reduce stigma around mental health, help men recognize symptoms early, and empower them to reach out for support. My short-term objectives were to increase awareness of crisis hotlines, encourage conversations around stress and emotional health, and boost engagement with the campaign materials. Overall, the campaign aims to make mental health care feel normal and accessible. Communication methods. For my campaign, I chose to use a printed flyer as my only communication method. I felt that a flyer made the message more approachable for college men who might hesitate to engage with mental health content publicly. Flyers work well in campus environments because they can be placed in locations where students naturally spend time, such as at residence halls, recreational centers, and dining areas. They also allow students to read the information privately without feeling pressure or embarrassment. I liked using a flyer because it is simple, cost-effective, and easy to understand at a glance. The layout helped me focus on the most important points, recognizing symptoms offering healthy coping strategies, and providing crisis hotline information. If I were expanding this campaign in the future, I might add a digital version or a QR code for campus resources, but for this project, I intentionally kept the communication method limited to a single clear, supportive flyer. Design choices and messaging style. When designing the promotional material, I wanted the message to feel human, supportive, and not overwhelming. I used phrases like support is strength and included relatable signs of emotional distress written in everyday language. For coping strategies, I kept things simple. Move your body. Talk to someone you trust. Get adequate rest. I chose calm colors, clear font, and highlighted the crisis hotline to make the support options easy to find. One challenge was keeping the text short but still meaningful. Piloting and feedback. When I piloted my campaign, I received really thoughtful and encouraging feedback from my classmates. Many peers said that they appreciated how the flyer addressed the stigma men face around expressing emotions. They specifically mentioned that the message getting help is not a weakness, real strength is taking care of yourself, was a powerful and supportive. Several peers said that the symptoms list felt relatable and easy to understand, and they liked that I included both the 988 crisis hotline and the crisis text line because it gives students immediate access to confidential help. I also received a positive comments about the idea of placing the flyers in locations where men naturally spend time, like gyms, barbershops, and workplaces. A few but small suggestions were offered as well. One peer recommended adding a simple call to action, such as start by talking to someone today. Another peer noticed small capitalization corrections. Overall, the piloting process helped me confirm what resonated most with my audience. The supportive tone, the relatable symptoms, and the crisis resources. It also helped me make small improvements that made my flyers stronger and more polished. Campaign effectiveness. Overall, I believe the campaign would be effective if implemented. It's accessible, relatable, and uses platforms students already engage with. It focuses on high-risk groups with simple messaging that encourage help seeking. To increase effectiveness, future versions could include a hashtag challenge, a series of short videos, or a campus partnership. Even though men's mental health is a sensitive topic, the campaign makes the message feel safe and empowering. In conclusion, this project helped me see how powerful communication can be in shaping health behaviors. Simple language, thoughtful design, and understanding your audience make a big difference. My biggest takeaway is that mental health messaging needs to meet people where they are, emotionally and physically. This campaign strengthened my skills in communication, design, leadership, and empathy. Skills I will use both in my professional and personal life. Thank you for listening.